The treatment options for fibroids depend on two things. One, the symptoms that they're creating, and two, what the patient's reproductive goals are. For those patients that are interested in maintaining their fertility, there are a separate set of considerations as opposed to those patients that are beyond wanting future childbearing. For those patients that are beyond future childbearing, there actually are more options. The most complete option would be hysterectomy. Hysterectomy is the surgical removal of the uterus, and that would remove the fibroids in their entirety. Other options for treatment of fibroids can include uterine artery embolization or uterine fibroid embolization. That's a procedure very similar to an angiogram where a radiologist will actually follow the blood vessels up to the fibroids and then block those blood vessels in order to cut down the blood supply. This is very effective for those patients that have large fibroids, bleeding as their primary complaint. It can be very, very helpful for people who are sicker and need to be able to get their blood counts up without really undertaking the dangers of major surgery. For people who want to maintain their childbearing, uterine fibroid embolization is not recommended, as it can have an impact on the health of the tissue of the uterus. Other things that are considered in those patients are what are called myomectomies. A myomectomy is a procedure done to remove specifically just the fibroid, but maintain the uterus. Myomectomies can be done several different ways, and part of that depends on the location of the fibroid and the size of the fibroid. For people with small fibroids that are contained within the cavity of the uterus, what's called a hysteroscopic myomectomy can be done. For that procedure, a small camera is inserted through the cervix and into the uterus. Water is then pumped through the camera in order to expand that inner cavity, much like a balloon, so that the fibroid itself can be seen. And then a device can be inserted through that small camera to help shave down that fibroid and remove it in smaller pieces, thereby restoring the normal shape of the cavity and removing the fibroid. For fibroids that are more within the muscle wall, an approach needs to be taken through the abdomen. For some patients, a laparoscopic approach where ports are inserted, instruments are inserted, and a camera is used to operate within the abdomen, and those fibroids are removed from the uterus and the uterus is repaired. In some cases, an open surgery needs to be done as well, where a larger incision is made and the manipulation and repair is done that way.